The only way that I can visit my son is to look at a box with his ashes that sit on the shelf of my living room wall.
Andrea Everett says Damian Hauschultz is out of excuses for his role in the death of her son, Ethan Hauschultz.
I've listened to people in this courtroom blame your parents for the reason why you've killed my son. I've listened to people talk about the trauma that you have gone through. We have all gone through trauma, but it doesn't mean that we brutally kill a 7-year-old.
Damian Hauschultz did not address the court on Thursday. Damian's parents, Ethan Hauschultz's legal guardians, were also charged. They were not home at the time of the incident. Tina McKeever Hauschultz was sentenced in March to 5 years in prison. Timothy Hauschultz faces several charges, including felony murder.
I know this kid. I would trust him around my kids. I want to let him watch my kids. I want to let nobody watch my kids. But I wish people could get to know him.
Judge Geraldine Dietz sentenced Damian Hauschultz to 20 years in prison and 10 years of extended supervision.
My goal is to ensure that you are incarcerated for just long enough to mature and develop, to work on education, work on treatment, work on controlling that angry side that, again, took full control in April 2018, and we never want to see take full control again.
A letter was also requested to the mother from Damian Hauschultz after 5 years detailing what he's learned.
I strongly believe that well into your 30s is necessary for you to have the development, the maturity, and the time needed to ensure that you no longer pose a danger to the community. But I also recognize that you should be released while you are still a fairly young man with a great deal of opportunities ahead of you to do, I hope, exactly what Ms. Everett hopes that you will do and make something good from your life out of this very tragic situation.
St. Elizabeth's emergency response procedures were in place at 9 a.m. Thursday, according to a written statement released by Ascension, Wisconsin. In the statement, Ascension says a chemical gas release happened close to the hospital's emergency room.
They gave the warning when we first got here that there was a chemical spill like in the OR area. Other than that, that was about the information that we got.
We reached out to Ascension multiple times to try to get an in-person or on-camera interview and get some answers to those unanswered pertinent questions both viewers and we had. But they said they would not be providing an on-camera statement. David Rabe of Appleton was at St. Elizabeth's with his wife, who was getting blood work done.
Waiting, and it took a little longer because they had too many other crisis going on.
The Appleton Fire Department was immediately notified to check the air quality.
They had all of the rescue people inside checking everything.
Crews could be seen donning hazmat suits, and a blue container the fire department says the chemical was believed to be in was in the middle of the road right outside of the hospital. Because the emergency department is in such close proximity to the impacted area, out of an abundance of caution, Ascension says Gold Cross Ambulance transferred the 13 patients to other hospitals. Several healthcare workers in scrubs were also evacuated from the hospital.
They had a lot of hospital workers out here standing out of the rooms, so other than that, that was about it. Just the fact that it was just a clear to goal, and nobody seemed to be in a hurry.
The fire department was able to take control of the situation and manage the air quality.
At least on that part. In the clinic here, we didn't smell nothing.
Evacuations were lifted at 11:15 and normal operations resumed.
We could see them walking slowly back in, but didn't hear any medical conditions from anybody that was there.
Ascension says there was limited exposure to associates who were immediately treated for minor symptoms and released. No serious injuries were reported.
The 7-day average for new COVID-19 cases in Wisconsin is up about 1,000 cases a day right now compared to the start of September last year. They've been climbing since July, a major difference 1 year ago when the pandemic's worst surge was just beginning.
It's not waiting for one. We're in the middle of one right now.
But could it get to a level that we saw last fall?
You know, it could. You know, there are definitely different circumstances going on now. some that are good.
Prevea Health President and CEO Dr. Hauschultz says the good news is we have a good percentage of Wisconsinites vaccinated. He says more people are also understanding of the need to mask up. However, Dr. Rye says the bad is the virus we're dealing with now, the Delta variant, is much more difficult to contain compared to the original strain last fall.
From a time that somebody was exposed to turning positive and being able to do the contact tracing, we had a little bit more time, and it was less people. Now, the way Delta, the variant spreads, you have to really be on top of it to mitigate almost instantly to mitigate. So spread is just happening at a level much higher than we saw last year.
The current 7-day average for cases is about a quarter of what it was at the peak of last fall's surge, which was on November 17th. The average number of deaths reported per day is 10% of its highest mark in early December. People being treated for COVID at hospitals statewide is also lower, about 40% compared to the peak number last November. However, Dr. Rye says this week in Brown County, COVID hospitalizations are at or near the peak for 2021.
And we're just trying to do what we can to support them, but there's just certain things that we can't do that the community has to do, such as getting vaccinated, such as wearing masks, and just reduce that disease burden on the hospital so the staff can get some breathing room.